Okay.
Good morning, everyone. Welcome to Dr. Renee, my page. I am here today to talk about a really amazing invention. I think it's the best innovation that we've had, especially with the pandemic. And it's with my friends at Omron. And so today I have Dr. Lucas with me, who is somebody using this fabulous innovation. And so I hope that if you have any questions, any of my colleagues, doctors, please type them in the chat. We will try to get to them. And if you have to, please send me a message after. That's fine. But I hope that everyone will jump on this, especially those who are caregivers, because you need to talk to your parents' doctors and convince them to do this. But Dr. Lucas, thank you so much for joining me this today.
Thank you for having me.
So please tell everyone, what is Vital Sight, and yeah, just start with that. What is Vital Sight?
Vital Sight is a interactive program that allows the physician to see blood pressure readings that the patient does at home. So it's a proactive system that connects the doctor's office to the patient so that when the patient checks their blood pressure at home, the information is automatically transmitted to the doctor's office so that they can see that in real time and make active interventions.
Awesome. So the first thing that someone's going to say is, well, my patients don't all have Wi-Fi.
That is the amazing thing about, if I were to say the single best thing about this program, is the fact that you don't need Wi Fi. This little device right here allows the patient to take their blood pressure at home, and then it is transmitted through this device right into the doctor's office. Because one of the problems that I had when I first started was I had actually known that during the pandemic, it became important for me to monitor my patients' blood pressures because they were going to the hospital for something else. And because my office was closed, they would come to me and say, "Oh, when I was in the hospital, my blood pressure was 200 over 100." I had nothing that I could do for them except say, "Okay, maybe get something from Amazon and we'll try to monitor it or do something like that." But it was not really good medicine because during the pandemic, my office, we really were badly affected by the pandemic. I lost my staff, or at least half my staff was gone. um, I had to basically be the doctor, answer the telephones, do everything. The emergency rooms were closed for a while, urgent cares were closed. And for a while, I was the only thing that stood between my patients and death almost because I had to try to manage them as much as possible so that I had to find a way to extend myself and be able to monitor blood pressures as well as take care of acute problems so that I knew that I wanted patients to be able to monitor their blood pressures at home. So initially, I saw in a throwaway journal a blood pressure system that would allow you to monitor the blood pressures. The patients would download an app on their phone, and then they would call you, or they would be able to type in their blood pressure readings. And so I initially thought that I would use that, but I wanted to use they let you use any blood pressure system, but the only thing worse than no blood pressure readings
Is a
were
bad one.
inaccurate blood pressure readings. So I had to get one that was validated by the American Medical Association establishes some validated blood pressure cuffs that you can use to monitor blood pressures because I had to have something that provided me with accurate readings. But I couldn't have patients calling me. I mean, I was already short staffed. I couldn't have people calling me with their blood pressure readings every hour or something like that. So I was initially trying to make an arrangement with Comcast, which is our internet provider. And I was trying to talk to the president of Comcast to see, if I could get something going, but, it didn't work out. And then there was a way of who's going to pay for this? Am I going to pay for all my patients' internet readings while they do this? So that I was looking at Omron, and initially my idea was to just buy a bunch on Amazon and give it to patients. But and I went to the Omron website to see if there was a way that I could get a bulk discount if I
Right.
could do that. And then I saw the Vital Sites program. And the Vital Sites program was especially designed. The thing that really caught me was the idea was zero heart attacks, zero strokes. And I said, wow, that is perfect for my patients. That is what I want. And it landed up that it was a real comprehensive program that allowed you as the physician to, or the provider, to have the patient get delivered to their home a blood pressure cuff with, in my case, I also wanted a scale because my patients were putting on pandemic downs. And also this transmitter that was especially programmed at Omron to interact with a dashboard in your office so that you could see on a daily basis all the blood pressure readings that came in on your patients in a click of a moment. And it was also a task that you could outsource so that basically you're extending yourself and I hired a remote nurse to monitor it for me. And I told him the parameters that I wanted to be notified with so that the patient's blood pressure was elevated, call me. And so that allowed me to basically extend myself. Also, by doing this, I fulfilled criteria that insurances have established. In fact, insurances have realized how important this type of technology and this type of interaction with your patient is. And most insurances allow you to bill for this. So this was, good because it allowed me to get paid for the time that I put in to provide good medical care. So not only did it allow me to monitor my patients' blood pressures on a regular basis so that I could intervene early in treating them, but it also allowed me to prevent them to have to go back to the emergency room if the blood pressure was high. It allowed me to monitor as I made therapeutic interventions. It also allowed the patient to have a contact with the office. So that I gave the patients the contact of my remote nurse so that they could contact him if they had any medical problems that kind of offloaded some of the burden from me. So, what's really nice about this is that this dashboard keeps track of the interactions, the time interactions that you have with the patients, so that at the end of a month, you can see, okay, I've talked to the patient this amount of time, the patient has done this number of blood pressure readings. So, therefore, in some cases, it interacts directly with the electronic medical record. In my case, I have to scan it into my electronic medical record, but I have records right there of all the blood pressure readings that my patient has done. Also, it has really decreased. I've been able to show that this has decreased emergency room visits. It's also decreased the number of times that patients have had to come into the office because I'm able to see on an immediate basis what what's happening with their blood pressure as I have the therapeutic intervention.
Yeah, that's just awesome. And also, I want to let everyone know Amron has fabulous products that, as she mentioned, are on Amazon, and oh, they're in drugstores. They're everywhere. But Vital Site is special. You cannot just go to the store and get it. You have to, as a patient, your doctor would have to be participating. But for doctors, you can go to the website. The link is here in the post, and go to the website and get information to get Vital Site at your office.
That is correct. And it's really been helpful as mainly from the physicians or the provider standpoint. It's been helpful because even before the pandemic, it was patients would come to me with an elevated blood pressure, and it was hard to tell whether it was something that was acute or something. Well, I didn't take my medicines today, or it's white coat syndrome. I did not take. I had stress today, or they drank a cup of coffee before they walk into the office, or it's fine every other time except when they walk in my office. But by doing this, I'm allowing the patient to also see what's going on with their blood pressure on a daily basis so that they become engaged in their own care. And that's what's so important about this whole process is that you engage the patient in seeing what actually is affecting their blood pressure so that they can see things that they eat, things that they do, and other things that will cause their blood pressure to become elevated. They can interact and try to prevent those problems. And, part of this is, part of the discussion that has always been a problem, with patients taking blood pressure pills is I don't want to take more pills. And it's hard to convince people to take medication for problems when they don't have any
Symptoms.
symptoms from it.
Yeah.
And many of them, particularly, people are concerned about the side effects of blood pressure medication. So, in addition to providing just the medical component, we also have intertwined a lifestyle component with this. And part of our message to each person is lifestyle modalities that they can use to help um, lower their blood pressure without medications. And then when they institute those lifestyle modalities, and they can see immediately the effect of those modalities on their blood pressure, that helps as well. So
Yeah.
it's a win-win because the patient becomes involved in their care. And also during the pandemic, just the contact that my nurse has had with the patient has really been helpful because many of my patients have been isolated during the pandemic. And, just knowing that there's a way that there's someone there who's watching over them and who cares, I mean, that has meant a lot to my patients. And so that, we have paired it with a lifestyle weight loss program, and that meets weekly via Zoom. And each week they've been helping each other, give advice and things that they can do to help lose weight. And, some of my patients have lost over 50 pounds during the pandemic, which is, really quite remarkable. So that I think the biggest benefit is that patients become mindful of their blood pressure, because many times blood pressure is a disease that you're not really mindful of. And I can count on the number of my hand on my fingers the number of patients who have come to me and said to me, I want to control my blood pressure better. Whereas, I can, there's a rash on my nose, there's a my there's pain, there's this, there's that. And so often these are the things that dominate a office visit because they're
Right.
so acute. And so that you'll try to spend an hour trying to explain to a patient how important it is to control their blood pressure, and they'll say at the end of the visit, they'll say, I didn't come here for that. I came, give me something about this rash. And and so you don't have a chance to really, and then you see them 3 months later and the blood pressure is still high, and you have this sort of clinical inertia that you really have to overcome to give good treatment to patients.
Yeah. And so it is amazing that, you can follow them so closely, and it's so important. But what I also want to stress, because I know somebody is watching, is like, but my patients are of an older population. This is explained so well for an older population, correct?
Yes,
And they make it so easy.
this is so perfect for an older population. First of all, because it allows, you as a provider to have a lot more interaction with the patient without you having to necessarily do it. In other words, my nurse calls the patients at least twice a month. That gives the patients a real chance to talk and to really get to know the patients and to take care of the whole patient. So often we're during this course of an office visit, we have so many other responsibilities that we're trying to do. This allows you to have monitoring of your patient so that someone else besides you is able to contact you when they see a problem arising.
Right.
And we're always talking about preventing things, but just last week, I had a patient, for instance, her blood pressure would not go down. And it turned out that she had also diabetes and was having, silent heart attack. And we would have never caught that. So we got her into the hospital, and we were able to abort things before they that was something we would have never caught if we had
Hmm.
not been doing this regular monitoring. So it allows you to intervene earlier on problems and not have to wait until that 3 month appointment and then have to have a whole myriad of problems that you're trying to deal with. Um, and it allows you to have better accuracy. In other words, having one blood pressure reading once every
Yeah.
3 months is not as effective as having blood pressures done on a under real circumstances where the patient is in their real environment on a regular basis. And it, as I said, it makes the patient mindful. And just like people are mindful of the rash on their nose or the pain in their shoulder, they become mindful of their blood pressure. And so, I kind of tell them, sometimes I can't show them that, okay, this is going to prevent a heart attack or stroke
Right.
in 3 years, but I can show them often a decline in their renal functions as measured by the glomerular filtration rate. And I can say, oh, look, your glomerular filtration rate should be above 60. Look, it's down, and we want to stop that. And so sometimes by giving them some real um, goals and giving them real parameters that they can follow that emphasize the importance of what they're doing, then it does raise it to the level of mindfulness that maybe the rash on their nose would have. And so
Right.
they're helping you, they're engaged with taking care of themselves, and it doesn't just always put the burden upon you to do all of the convincing to take medications.
Yeah, they numbers don't lie, as they
Mhm.
say. Numbers do not lie. So when you can show some, because like you said, once every 3 months can be a whole different picture. But when you see, fit you're looking at it every day and you're like, wait a minute. Oh. Or after I ate such and such, I took my blood pressure and it was this, and then after I ate that, all these different things that they can see after I did this exercise or didn't exercise, all these different things that these patients, things that we've been trying to tell them, but now they can see it for themselves. And that's so important. But I really want to stress that Amron makes it so easy. They explain how to, install this transmitter. They also explain how to properly take the blood pressure because, like we said, you don't want, a reading is great, but you don't want it to be a wrong reading. You want it to be an accurate reading. So they explain how to do that to make sure that they are taking their blood pressures correctly. Um, and so this equipment is and this the patient doesn't have to pay anything for this. The insurance does cover this, correct?
Yes, many insurances, in fact, most insurances are paying for this as long as you meet, there's certain criteria that you have to meet as far as patient engagement and the number of blood pressure readings that you take in a monthly basis, so that you really have to have an engaged person. And so that patients have to realize how important this is for their health. And there are some that are not going to be, that if you care more about a patient's health than they do, then maybe this is not a patient that should be engaged in the program.
Right.
The patients who are really interested in staying, living longer and living better, especially when they see the damage that high blood pressure can do, especially on their kidneys and their heart and their blood vessels, you know, those patients really benefit from becoming engaged with this. And most insurances pay for it, or sometimes people do have a small copay. But I tell people that this is in lieu of taking a medication. So this
Hmm.
is your taking your blood pressure keeps you mindful. And just like when you keep a diary of the foods that you eat, it keeps you mindful of how many calories you're taking in. This also keeps you mindful of the effect of other things that are having on your blood pressure.
Yeah.
And also, a lot of people are, have stresses. And I kind of make them aware that look at this stress, how it's affecting your blood pressure. And you're giving up days of your life being stressed by this person or by this job. And look, let show it the effect on your blood pressure and ask yourself, is this worth dying for? Is this worth giving up days of your life for? So that I really stress the importance of patients becoming aware of how things are affecting their blood pressure as well.
Yeah, that is very important. Very important for them. Like I said, to see it. When you seeing is believing.
Yes.
We can talk and talk and talk, but if you see it for yourself, it's a game changer. And I love that it's the older populations. I love that, Medicare is covering this, correct?
Medicare is
Yeah.
paying for this. And
Medicare is paying for this, so it does it. This is eliminating the whole, gap between, whoever has money and doesn't have money necessarily. This is getting covered, and like I said, the older population, which is who the people usually that need it. Although I know a lot of people in their 30s and 40s that have high blood pressure that need to take their blood pressure every day and that are on blood pressure medication. But we do usually tend to see this in older populations. But like I said, anybody who has a blood pressure that needs to be monitored closely, this is a great program for your patients. So, internal medicine physicians, family medicine physicians, even, I guess, even some OBGYNs, if you have to monitor blood pressures during pregnancy, this is an awesome program that I think that you as a doctor can benefit from, because then, like she said, it cuts down on office visits. And then as a caregiver, as a care provider, it really, especially in our elderly population, they love to sit there and talk to the doctor. And we all know we do not have hours and hours of time with each patient. You just don't. But with this, you can talk to them more because you have someone who can speak to them on a regular basis and follow up them, and they'll feel special. And I mean, and that's really what they want. They just want to be seen. Some of these people don't have anyone, they're alone. And so this is a great way to give even an extra perk in your practice. So I highly encourage people to check out Vital Sight, because I think that, it is really, especially in the pandemic when, you know, our elderly population was the first ones that we said COVID was affecting. So those people did not want to be anywhere near a hospital nor a doctor's office because they didn't want to get sick. So this way they could still have their care but not have to leave their homes. So I think that that is so important.
I think you're right, especially in the idea of overcoming some of the health disparities that occur. So many of my patients, first of all, not being able to take time off from work. I almost had to take, for some of my older patients, had transportation issues. The idea of not checking their blood pressure for 6 months or 3 months, during winter or whatever, that was a real possibility because they could not get transportation. And doing telehealth is a real, it has really been beneficial for so many of my patients. For working patients, it allows them not to have to take a whole day off to come to the doctor's office. For patients who have transportation issues, they, don't have to worry about it. So, and they don't have to have internet. They don't have to have any of the fancy stuff that many of us take for granted.
Right.
They don't
Barriers,
have,
really.
yeah, they don't have to have it. So a lot of barriers are overcome by this program. And plus, it's good medical care.
Hmm.
Also, from the provider standpoint, it allows you to do things like annual wellness visits. It allows you to, do quality metrics. It allows you to do things that you wouldn't be able to do if you did not have this tool in your armamentarium. So, it's basically, I would say, it's allowed me to expect to leverage technology first of all, which is always good, and to get by with less staff but being more effective staff. For instance, now one of my staff who I was going to have to, she went on pregnancy leave and wasn't going to come back. I've now assigned her to this group of patients so that she can deal with just all of their gaps in care and take care of all their medical problems
Wow.
directly and on her own time. And so I'm able to have flexibility for my staff to be able to take care of patients, whereas I would have possibly, it's hard for me to find staff right now. So it allows me to extend myself and extend the quality of my care in many ways. But most importantly, it is patient centric in that you're able to be proactive in your care and not always be reacting to, I went to the emergency room and my blood pressure was high. You're actually able to see, okay, your blood pressure is staying high for over a week. we'll call immediately to see is there something going on or what's happening, and we're able to be proactive as far as our interventions, as far as things are concerned, and overcome the clinical inertia that occurs during regular office visits.
Yeah, definitely. Um, and so please, like I said, we've said, and I'll say it again in the post, we have the link. Please, doctors, please check out Vital Site and see if this would work for your office. Dr. Lucas, you were not doing telehealth prior to the pandemic, were you?
I was not doing telehealth prior to the pandemic. I We had to, first of all, I had no staff. So, but the last day that I had in-person visits, um, I saw a patient, and by Tuesday, she was in the ICU, and 8 people who had attended a weight loss program, Weight Watcher program with her, were dead of COVID within the week. So it really affected our practice very badly, and people were afraid to go out of the house.
Yeah.
It was really a very scary time, and I really vowed that I would never let this happen again, where I could not provide, the care that I needed. So by having the Omron program, basically I'm able to have not just myself, but also I have this whole extra extension of my office whereby I can monitor it without having to get telephone calls, blood pressure readings, or things like that. So I'm able to have someone else, almost like an extension of myself, to
Mm-hmm.
monitor me and to contact me when things are awry so that I can intervene early and prevent problems.
Yeah, it's a game changer. And like she said, she wasn't doing telehealth before, but now she now has this flexibility to do that. And and just like with her staff, being able to help them to be flexible as well. This one thing the pandemic taught a whole lot of people was that you don't have to go into the office. And here you thought the doctor you had to go, but look, you might even be able to not go into the office for that as well. So and the one thing, blood pressure, and I mean, obviously our womanly things are something that we have to do. We cannot do that telehealth, but blood pressure is so important to everyone, man, woman, and child. So it is good that we're able to do this and be able to get accurate reading, which is of course the most important thing, is accurate readings, even though we're not sitting in the office. And I think that you've educated a whole population of people because they had no idea. Yes, you had told them a million times how important the blood pressure was, but now they can see it for themselves. Because let's be clear, when you take your blood pressure to the doctor's office, do you ever actually see it? You know what I mean? I mean, most people that have their blood pressure taken don't understand what's, because we don't use digital usually in the office, so they don't understand what's being seen up there, and they just hear what you said. They don't see it, and seeing is really believing. A lot of people need to see things. They can't, hearing is one thing, but they need to see it. And for them to see this thing every day and say, oh, and they can see, oh, it was this on Sunday and now on Friday it's this. Oh my God, they can see all that. And so this is nothing but to really help you help your patients more, which is why I'm like, I'm serious. I've already said I'm going to talk to my parents' physicians because they need to get it, because this is just a complete game changer. When my father first came home, we had to take his blood pressure, I think 3 times a day. Yes, because one of his medications, depending on his blood pressure, that's what, either he took it or didn't. It was a whole lot. And so, and this was just us, monitoring it ourselves. So if we had, the flexibility in your vital site, and we could take it, and then the doctor could say, okay, you don't have to worry about it. Or you, because we were like, well, it's on the border. Should we? The doctor can say yes, no, maybe so. And that's perfect, and that takes it off of the patient. And the doctor can, you don't have to worry about. A lot of people are not fond of hospitals. So even if they took their blood pressure and it was sketchy, they still may not go to the hospital. But because the doctor will be alerted to know that your blood pressure is not good, the doctor can immediately intervene and say, you need to go, or this is what you need to do. Take this. And that is just, that is going to help a whole lot of people, because especially because we are now experiencing Omicron, and Dr. Lucas is in Michigan, and we know Michigan, unfortunately, is having a very, very high number of COVID breakouts recently. Our numbers have completely went in the wrong direction, and so now you don't want to go to the urgent care, you don't want to go to the hospital because COVID is running rampant. We unfortunately our hospitals are completely just they can't take on anymore. They've brought in the National Guard to help, so the last thing you want to do is send a patient that's not really having a heart attack because they don't know what's going on. You have vital sight, you can see exactly what's going on, and you can figure it out you can intervene before they have to have the 911 called or whatever. So I think that it is just, I mean, Amron comes up with the best stuff ever anyway, but this is one of the best innovations that I have ever heard about. And my biggest thing is, because obviously we're both Black women, my biggest thing is that the barriers are removed, because we have so many health disparities and there's so many things in the Black community, especially hypertension is one of them. And now we can completely, anybody can get this. They don't have to be wealthy. They can get this program as long as their doctor participates in the program. So that's why we're speaking to you physicians to please make sure that you check out the link and see if this will work for your office. And I'm sure it will. And your patients will love you even more for it. And so you have many success stories, I'm sure, from being able to see what's going on and intervening right away.
Yes, I have. Many people have, I can't count how many people have avoided heart attacks and strokes, but I can say that many people who are having decline in their glomerular filtration rate, we've been able to stop that, and in fact, sometimes improve it. The weight loss, of course, has been wonderful for patients to. And then, as far as emergency room visits, we actually, because I'm a participant in some of the quality initiatives like CPC Plus, they wanted to show that things like this would actually be effective. So I actually did do a small study where I could show that there were less emergency room visits by patients who used the Omron system than who did not. So that it's a win-win all the way around. And basically, it's something that we as providers have to do anyway, but it's nice that the insurance companies will pay for it, and to pay for good medicine and to overcome these disparities that really affected people of color more than anyone else, because um, a lot of people, of color are working in service industries where they can't just stay at home and work behind a computer or
Right.
do those type of things.
And during the pandemic, they did have to go to work. Those were our
Yes,
frontline workers. Thank you to them. The
yes,
grocery store, the bus drivers, the train operators, all of that.
those are our heroes, and we have to take good care of them, and they're working at personal risk. And so, as much as we can do to keep them healthy and to prevent health problems for them, we owe it to them. And then, of course, our elders. They've made so many sacrifices so that our generation has been able to succeed as they have. And so often, they've been hampered by um, you know, financial, there are so many things that have hampered their ability to receive the care that they need. And being able to provide this to them has really been very helpful.
Yeah, definitely. So for the holidays, do you have any tips that physicians could give to their patients to help them manage their health going into this is the holiday season. So Hanukkah just passed. So we have, Christmas and Kwanzaa and then New Year's coming up.
Yes. Yeah. So basically, what I do is I try to tell people, first of all, it's a good time for us as providers. We always want to make sure that we do as much as we can to maintain the health. It's a time when people, kind of kind of forget their health uh, goals, sort of. And so trying to get them in touch with uh, like cookbooks, soul food cookbooks that allow you that teach you how to cook way in ways that promote health. and it's a time when people are getting together as families. So it's a time to promote health goals, to share with their family
Mhm.
their medical problems, and try to say, okay, hey guys, I think that we as a family, we have diabetes in our family, we have high blood pressure in our family. We need to start eating a certain way. We need to start doing certain things. And we need to start doing things that, at the meetings, we need to like have things, I tell people to just, instead of just sitting down and eating dinner, tell people to
Dance,
get
play
up.
some music. Yeah.
I mean, instead of everybody just sitting down, just sitting there, there's nobody who could sit down and listen to them. Have the generations connect. Have them, have your teenagers teach the elders how to do the electric hustle. Try to keep it something that is real that you could do that is sustainable. Because it's
Yeah.
nice to say to do things on a short-term basis, but it's important to have them develop things on a long-term basis. Have a, family, have the goal for family dinners that who can cook the healthiest way and
Dish
make
or
it taste
whatever.
good, as opposed to, who can make the biggest pound cake. So, that's the type of thing is that it's a time to really stress to the family, at the importance of good health, and during family gatherings to, have dance contests, have, younger generations. Like for instance, I had my my daughter, I would pay her to develop an exercise plan for me, and that gave a lot of benefits. First of all, it was some one-on-one time. I have 4 kids, so it was nice to have some one-on-one time. It taught her some things. It allowed me to have some time with her. She did teach me the hustle, but I totally forgot it. But, it was really, and she developed those habits throughout her life. So it's important. I think that this is the time that we have to re educate, especially people of color, that unlike the good old days when we worked from sun up to sundown, we're not working like that anymore.
Mhm.
And although some people would like those good old days to come back, we're now sitting behind the desk. We're now doing things that are not physically active.
Right.
And we need to, you know, develop new habits and new ideas as far as how we deal with, eating and exercise and activity. Also, we have to also learn to manage stress. A lot of us are under a lot of stress, and to have ways to be able to get counselors, because a lot of us don't express that as much as we should. And maybe it might be you don't want to go to a formal counselor, but maybe talk to a pastor. A lot of churches have been closed, so that there may not be a lot of ways to express some of the stresses that people are having. Many of us have lost loved ones due to the pandemic. So sometimes I would say to have a behavioral counselor. I have one through my PGIP, through my physician organization, that can reach out to patients to talk to them. I think that the whole concept of this remote monitoring system, where I have my nurse contact the patient a couple of times a month and just talk to them, is therapeutic. Just have because um, if we have to go down into full isolation again, that can be very harmful, especially to older patients.
Mhm. Yeah, definitely. And the holiday season tends to be a stressful one anyway, so you have to do whatever you have to do to deal with the stress, but don't, eat horribly or drink or something. Exercise, walk, run, dance, do something. And I think that a lot of people realize they forgot that back in the day, our ancestors, they did hard labor, which was very intensive, and that was their exercise. They didn't have to go to a gym, and you still don't have to go to a gym, but sitting down all day every day is not helping you. So if you get up and dance for 10 minutes 3 times a day, you've done your 30 minutes. You got to do 30 minutes of cardio a day, 5 days a week at least. And that will keep your heart going and hopefully keep your blood pressure in its right range. But you got to do something. You can't do nothing. You got to do something. If you it's just walking around your house, or instead of sitting watching television, you walk or you stand, or during commercial breaks do some sort of exercise during commercial breaks while you're watching television, movies, whatever. But some families play sports on Christmas Day when they get together for dinner. Whatever you have to do, do something to make sure you're getting the exercise in. And just because it's healthy does not mean it tastes bad. So you can have food that does not have a lot of salt in it, but has great flavor, because there are a whole lot of other seasonings in the cabinet besides salt. So, and salt, as we know, is not our friend, especially when it comes to Black people. Salt is not our friend. So, therefore, everyone should decrease their salt intake and figure out what other seasonings you can use to make your food taste great. And to remind all of us, especially in this holiday season, do not cook the greens all day, because you will cook all the nutrients out of the greens. If you saute them, they will taste really great, but they will still be very nutritious. And so, candied yams, there's ways to get around that, because we know diabetes is a huge problem. So, there's ways to eat candied yams, but it not to be so sweet. You can use alternative things. Now, I'm not saying use aspartame, but I'm saying use some natural sugars, natural sweeteners, so that your candied yams do taste sweet, but they're not full of sugar and full of butter. So there's always ways. The internet's your friend, and there's always ways to make things healthier so that everyone survives dinner. There are numbers that talk about how many heart attacks happen after these big meals, Christmas, Thanksgiving, and stuff. So we want to make sure that all of us that are here make it into the new year. So, thank you so much, Dr. Lucas, for your time. And you guys, I have mentioned a million times, but the website is in the link. The link is in the post. amronhealthcare.com/vital site is the website for you to look into getting Vital Site at your office. And if you're just a physician that is not a primary care physician, but you're just a physician, maybe you should pass this information on to a colleague and see if they would be interested in getting this program, particularly if they're taking care of your parents. I'm part of the sandwich generation, as are you, Dr. Lucas, and we are taking care of our parents and everyone else. And this would be very beneficial to our parents as they as in us as caregivers. So please, please, please check into Vital Site. Thank you again, Amron, for this amazing innovation. And please keep innovating, because they just keep coming up with the best stuff. So thank you so much, everyone. Have a great day. Bye.